Hello my geniuses, welcome to another anatomy lecture series. Today it's your great science tutor Lorenzo, and we'll be treating today Portal-Caval anastomosis. It's very important because during portal obstruction it can affect the channel. Naturally, the body always have a contralateral way to pass blood in case there's obstruction, but if there's intense portal hypertension, the Portal-Caval anastomosis will be affected. So it's a very good channel which we'll be talking about in this video. So if you are new to my channel, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video for you, also put it down in the comment section. If I go through it, I'll make that video for you. So let us jump right into the video. The first question I'll be asking now is, what is Portal-Caval anastomosis or portosystemic shunt? Portal-Caval anastomosis or portosystemic shunt. One thing you have to know, there are vascular communication. There are vascular communication between the portal vein and the systemic vein. The portal vein and the systemic vein. Now the portal vein is that most of the GIT organ drains through the portal vein, which means they pass through the kidney before they drain into the IVC. They pass through the kidney before they drain into the IVC or the SVC. But the systemic vein, they don't need to pass through the kidney, they bypass the kidney and then directly to the IVC or SVC. Don't forget. For portal vein, most blood supply in the abdominal cavity passes through the portal vein, which pass through the liver. While some systemic vein do not need to pass through the liver, they drain directly to the IVC. So it's either you pass through the portal vein through the liver, or you pass through the systemic vein. So it's one. So the connection between these two veins are called Portal-Caval anastomosis or portosystemic shunt, and they are majorly in 5 parts of the abdominal cavity. They are majorly in 5 parts of the abdominal cavity. That's where you can see this connection between the portal system and the systemic system. So one thing you have to remember the mnemonic. So I'll always give you a mnemonic. Always remember gut, butt, caput, bear, and back. Gut, butt, caput, bear, and back. Don't forget. Now the first one is gut. Gut is at the lower end of the esophagus. Gut. So that gut now, where is it? At the lower end of the esophagus, now you have the esophageal tributaries. The esophageal tributaries of the gastric vein. The esophageal tributaries of the gastric vein. This one it drains into the portal vein. The esophageal tributaries of the gastric vein drains into the portal vein, while the esophageal tributaries of the accessory hemiazygos vein drains into the systemic vein. So the esophageal tributaries of the gastric vein drains into the portal vein, while the esophageal tributaries of the accessory hemiazygos vein drains into the systemic vein. So that connection gives you the Portal-Caval anastomosis. And now anytime there is portal obstruction or there's cirrhosis of the liver, what happens? They will become tortuous. The veins will become tortuous and enlarged. So if you become tortuous or enlarged, there will be portal hypertension, which can cause rupturing of this vein. It will cause rupturing of this vein, causes hematesis, and hematesis cause the patient to be bringing out or vomiting blood. There will be hematitis or hematesis. The hematesis is the process whereby you vomit out blood due to the rupture of the esophageal vein due to portal hypertension. Nice one. That's your gut. Gut is at the lower end of the esophagus. The next one is butt. Butt means down, rectum, down. Now what is the anal canal, the downwards part now? Now you have your superior rectal vein. The superior rectal vein drains into the drains into the inferior mesenteric vein, which drains into the portal vein. The superior rectal vein drains into the inferior mesenteric vein that drains into the portal vein. While the inferior and the middle rectal vein, drains into the internal iliac vein, then drains into the systemic vein. You see. So and both of them are anastomosed to form a Portal-Caval anastomosis. Now when there is portal hypertension or any obstruction, what will it cause? It will cause hemorrhoid or pile. It will cause hemorrhoid or pile. Why for the esophagus? It will cause esophageal varices. It will cause esophageal varices, which will lead to hematesis. Hematesis means vomiting of blood. So you have esophageal varices, which causes hematesis, vomiting of blood, and the next one is hemorrhoid or pile, which causes bleeding from the what anal canal. So you have either you bleed from the guts, which is your esophagus, or you bleed from your butt, which is your what bile, which is what we call internal what hemorrhoid or internal bile. Don't forget. Guts, butt, caput. What is caput now? Caput is, now you have two veins. Now the first vein is the paraumbilical vein. Paraumbilical vein, which is a portal vein. The paraumbilical vein, which is a portal vein, and you have the superior, and you have the superficial epigastric vein. The superficial epigastric vein, which is systemic. Paraumbilical vein is a portal vein, while what superficial epigastric vein is the what is a systemic vein. The anastomosis between these two veins causes what Porto-Caval what anastomosis. And when there's portal hypertension of this place, it causes what we call caput medusa. It cause caput medusa, where there will be line tortuous veins around the navel. You see some tortuous dilated veins around the navel, so we call it the caput medusa, because it was coined from the medusa, when a snake that has many heads. So that tortuous veins around the navel is the medusa, is the snake head they call caput medusa. So we have guts, we have butt, we have caput. The next one is bear. The next one is what? Bear. Now what is bear? In the bear areas of the liver. Now in the bear areas of the liver, now it's when you have a Porto-Caval anastomosis there, when the inferior what phrenic vein, which is systemic, where the inferior phrenic vein, which is systemic, now anastomose with the what hepatic vein, which is portal. Again, when the what inferior phrenic vein, which is systemic, anastomose with the what hepatic vein or the portal vein in the liver, when there is an anastomosis of these two veins, it forms a Porto-Caval what anastomosis. And when there's portal hypertension, maybe when the liver is cirrhotic, when it's cirrhotic, it can what affect that part. So when there is damage to the esophagus, when there is rupturing of the esophagus due to portal hypertension, it causes esophageal varices. When there is occultation or obstruction in the between the superior rectal and inferior and middle rectal, it causes what internal bile or hemorrhoid. When there is on portal hypertension between the paraumbilical vein and the superior epigastric vein, it causes your caput medusa. And the one for the liver too, that one affects, causes during cirrhosis too. So the last one is back. What is back? Retroperitoneal organ. Now one thing you have to know now, the retroperitoneal vein. So one thing you have to know now, the retroperitoneal veins are systemic. Now the retroperitoneal veins are veins of the posterior abdominal wall and the renal capsule. They are what? Systemic vein. Why the veins of the colon, ascending descending colon, veins of the pancreas, they are all portal vein. So the veins of the pancreas, they are all portal vein, while veins of the posterior abdominal wall and the renal capsule are systemic vein. When they anastomose, they form the Porto-Caval what? Anastomosis. So the same thing now. So we talked about the gut, which is the esophageal tributaries of the accessory Azygos vein and the gastric vein, causing what? Esophageal varices. Now we have the butt. Butt is now the superior what rectal vein, which is portal, and the inferior and middle rectal vein, which is what? Systemic, causing what? Internal hemorrhoid. Then we have the paraumbilical vein, which is portal, and the superficial epigastric vein, which is what? Systemic, causing caput medusa. So we have the inferior phrenic vein, which is systemic, and the portal branches of the portal vein or the hepatic vein, which is what? Portal vein. So both of them are caused during cirrhosis. Why the vein of the retroperitoneal organ, which is vein of the posterior abdominal wall and the renal capsule, is systemic, while the veins of the retroperitoneal organ rather, which is the pancreas, colon and co, they are anastomosed. So all these things gives you the Porto-Caval what? Anastomosis. So we have 5 different parts in the abdominal cavity which we have discussed. So the clinical correlation is portal hypertension. When is portal hypertension occurring? Now when there is obstruction to any of the portal vein, When there's obstruction to any of the portal vein, what happens? The tension increases, the portal venous pressure increases. The portal venous pressure is normally between 5 to 15 mmHg. So when it's greater between 5 to 15, if it reaches above 40, the portal hypertension increases, which will cause the veins to be tortuous. It causes the vein to be tortuous and the pressure will increase, maybe due to obstruction, or I said due to maybe inflammation in the hepatocyte caused by what? Alcohol cirrhosis majorly, or it can also be caused by what? Carcinoma to the hepatic cell, or anything that affects the liver. If it affects the liver, what happens? It will occlude the portal channel, thereby increasing what? Portal venous pressure above 40. So what will happen? It will causes what? Esophageal varices, can also cause what? Bile. It will cause what? Splenomegaly. The spleen will begin to enlarge because it's very, very important. A direct branch of the portal vein, a direct tributaries of the portal vein is the splenic vein. So there will be what? Enlargement of the spleen due to blockage of blood draining from the spleen. So it can also cause that. And that one, it can cause ascites. It can also cause ascites, which is the buildup of fluid in the peritoneal cavity. All this can be caused by portal hypertension. So I hope it all made sense and you understand everything I just said. Always like, follow, share my videos because you understand. I'll also give the mnemonic in 60 seconds. Remember, gut, butt, caput, bear and back. When you remember the site of Porto-Caval and Anastomosis in the abdominal cavity. I'll be seeing in my next video. Always watch my video continuously. Bye bye.